When you say cancer, I know the patient is thinking or the family members is thinking when I'm going to die. In Sabah, it's one of the highest numbers of oral cancer patients in Malaysia. But not all cancer will end up in dying. She hold my hand, she started crying and said that, tolonglah doktor, buat apa saja, saya akan ikut apa yang doktor cakap. Saya nak tengok anak-anak saya membesar.
Sebelum SPM, there's something in my cheek, you know. They said it's lymphoma. It's good that you came early untuk buang. How do you know if you come early ataupun lambat?
One of the most important functional issues that will need jaw surgery is to snore a lot at night. When they sleep, suddenly they wake up because they got not enough sleep. What happens is they cannot perform well in the work. They'll be very groggy, stressful and all that.
Alright, welcome back to Step It Up Lounge, di mana kita invite inspiring individuals dan professionals untuk share dia punya journey dan experiences. Dan hari ini kita ada Dr. Sara.
Hai.
Dr. Saravanan,
Dr. Saravanan, ya.
Tapi boleh panggil Dr. Sara lah.
Boleh Pak, semua panggil Dr. Sara.
Ya, kan.
Yeah.
So, Dr. Saravanan ataupun Dr. Sara adalah seorang pakar bedah mulut dan maxillofacial di Hospital Queen Elizabeth KK. Betul?
Ya, betul ya.
Dan dokter, so boleh explain nggak apa itu maxillofacial?
Okay, maxillofacial initially dia dulu it's called oral surgery. Oral surgery. It is a specialization daripada dentistry lah. Maknanya we will do basic degree in pergigian, dentistry, and then after that we will specialize in so many other specialty lah in dentistry. If you compare to medical, kan, they do MBBS. And then they go and do surgery.
Okay.
And then some of them they go and do medicine, another specialization in medicine. So if you see people like nephrologists, right? Nephrologists are the people who give medication, do a bit of simple procedures to treat the patient. But urologists are the surgeon.
Yeah.
Who go and do operation.
Okay.
So
I see.
So this is how in medical it differs. So in dentistry, same like that. So in dentistry, you do dentistry, then you go and specialize. So you can do specialization in gums. So you are called periodontist.
Yeah.
You can do specialization in forensic dentistry. So likewise, oral surgery is one of the specialization in dentistry lah. So how it became oral and maxillofacial surgery? So over the years, the specialty evolved. That means the type of work that we do expanded, right? So initially when oral surgery, we just deal with the teeth and the gums and all this. Now oral and maxillofacial surgery, it's so much expanded, where you do jaw surgery, you do tumor surgery, you do the joint surgery, you do a lot of other surgeries which was not done before. Like the scope of work increases.
So maksudnya before this maxillofacial, oral and maxillofacial dia tidak include jaw surgery and everything.
It is, but the type of work that we do is not as extensive.
I see.
As we do now. In fact, the term itself, and they when they come to see us, they will see we are the dentists in the hospital.
Yeah.
We do filling, scaling.
Sure.
That's the normal perception of the public. Because we are still, they call us a dental department and all that. That name itself is like a misnomer because we don't do. The last time I did filling was many years ago.
Wow. Yeah, so it's totally different.
Totally different than dental filling. It's more, it's partly dental, partly medical.
Okay.
This is the only specialty that it combines both
in dentistry.
The rest of it is mostly in dental field, like when you do restorative work and all that is dentistry. When you do denture, specialize in doing denture, it's restorative. When you do root canal treatment, it's also dentistry. But oral and maxillofacial surgery, it's more of a medical plus dentistry.
I
Yeah,
mean the name itself pun sudah give the idea kan,
yeah, correct,
facial.
correct.
So
Yeah,
facial, anything you do with the face is
yes, correct.
termasuk dalam
That,
medical sudah.
yes, correct, correct. Yeah,
Yeah.
yeah. So that's how it expand. That's how it came about. Maxillofacial
I
surgery.
see. Berapa berapa spesialis di
Sabah.
Sabah for this part?
Okay. Initially when I came, there was about 2, 3 surgeons.
Yeah.
Right. Now we have even in KK itself in Queen, we have about 4 surgeons.
Okay.
In Keningau we have 1. In Sandakan we have 2. In 𝙀𝙃𝙄𝙎𝙊𝘿𝙀 we have 2. In 𝙀𝙀 we have 2. You know. Now we are planning to expand to Labuan, Beaufort, those kind of things.
When you talk about maxillofacial, dia relate dengan pembedahan muka
Nah,
di bagian sini kan. Apa beza maxillofacial surgeon and plastic surgeon?
okay, it's a very good question because when I say maxillofacial, most of the time, they ask maxillofacial, they won't know. But I say, okay, I do jaw surgery. Oh, it's like plastic, is it?
Yeah.
That's the
Yeah.
common question they'll ask. There's a lot of overlap between plastics and us. They also do like what do you call that? Their work is our work is like mostly on oral and facial surgeries, orthodontic surgeries, tumor work. I do here a lot of tumor work, oral cancers. Also, oral cancers comprises tumor resection. You have to do something called neck dissection. You have to do reconstruction. So where the plastic comes in is during the reconstruction.
Okay.
What do you call that? Some places we do our own reconstruction as well. So there's a lot of overlap between us and plastic. But plastic, they have their own bread and butters, like managing burn patient. It is they are the team that will manage those kind of
I see.
burn anywhere. They are the one who will manage. But otherwise, like even cleft lip and palate.
Sorry?
Cleft lip and palate surgery.
What is that?
Atau sumbing,
Oh, sumbing.
bibir,
Yeah, yeah,
bibir, and all that.
yeah.
It's an overlap. Like in KK, plastic does it. My friend Dr. Dewa, he does it. But if you take in Keningau, 𝙀𝙃𝙄𝙎𝙊𝘀, 𝙀𝙀, Sandakan, maxillofacial surgeon does it.
I see.
So
So
it's
maksudnya
like
dua-dua boleh buat lah.
it's like an overlap
Ah,
area lah.
so
Yes,
both specialists can do.
yes, correct. Yeah,
Macam itu.
yeah.
And about sumbing punya case di Sabah, mesti banyak kan di Sabah?
Yes, quite.
Because from when I was growing up juga,
Mhm.
I have friends lah. I grew up in Keningau.
Yeah.
And then I know some friends di Keningau and from Tambunan and even luar dari sana yang ada sumbing. So macam mana itu condition boleh berlaku actually?
Mostly I think it's secondary to late pregnancy, ataupun if they have taken some medication during the pregnancy, smoking, or inter relative marriage, or late pregnancy and all that, or genetically. That means if the family somebody has, chances are you might have the child they're going to born also might have.
I see.
Yeah, so these are the few risk factor or some condition that patient can have this cleft lip and palate lah.
I see.
Yeah.
Can lifestyle change that? I mean, eventually change kalau to prevent or reduce the risk.
Reduce the risk, like how do I say, smoking
Ah,
and those kind of things. Or if let's say in your family you already have somebody, then you better do like a DNA test or
Yeah.
something like that, and then see whether what are the chances for your when you conceive, what are the chances you will have in terms of like lifestyle changes, like if you eating and all that. There's no scientifically proven study shows that okay, if you eat certain things you can prevent.
Yeah.
But in general, if you reduce your this preservative food, oily food and all that, it is very helpful for any diseases for the
Sure,
matter.
for sure.
Any diseases for the
Yeah,
matter.
but for this one, it's mainly like genetics.
Yes,
Uh,
mostly yes,
yeah.
correct.
And you mentioned also pasal cancer case tadi. What's the condition like in what's the situation like in Sabah?
I can talk more about cancer because memang for the past 10 years I've been dealing with these people.
Cancer mulut
Patient,
lah kan.
cancer mulut, cancer mulut. These patients, when you deal with cancer patients, you don't deal only with the patient. You have to deal with the family members.
Oh,
It's a holistic management altogether, different. Because when you say cancer, the perception is another. When you say cancer, I know the patient is thinking or the family members is thinking when I'm gonna die.
that's the normal punya
That's
mindset.
yes, correct. But not all cancer will end up in dying. So when I come to oral cancer, in Sabah, it's one of the highest numbers of oral cancer patients in Malaysia.
Oh, really?
But the risk factor is a bit different here comparatively to Peninsula. Peninsula, it's more of a Indian race cancer because they take a betel nut,
Oh, pinang kan, pinang.
pinang, and also lime, and all
Oh,
that can cause changes in your oral cavity. In Sabah, if you take in Sabah context, here they take suntil, sigup,
yeah, gitu.
smoking. So these are for my experience, the sigup, suntil are the main culprit for because inside there they have this what do you call that, tobacco.
Betul,
So that tobacco got carcinogen, that means some
betul.
cancer
Yeah.
related substance that can cause. That's why in Sabah you see a lot of patient with a lip or buccal cheek cancer. Reason being they keep the cigarette
Yeah,
something somewhere here at the corner of the mouth and all that.
yeah.
So they keep it for a long period of
Mhm.
time, and then that changes into cancer.
And
Yeah.
how long does it take to have effect?
The time frame it's variable, but if you started very early, some people, that's why you cannot pinpoint and say if you take Sigu, definitely you're gonna get cancer at this age. Some people, even those Indian people who take Sire and Kapo or whatever, until they die, they don't die of cancer. They don't have,
Yeah.
Some people they'll just start 1-2 years, pop,
I
they have.
see.
So the time frame, it is not we cannot frame it to okay, if you take this year you'll get this. No, but we know if you take this, chances are you're going to get oral cancer comparatively to somebody who don't take it.
Yeah.
That means
sure.
your risk will be higher comparatively for those who don't take it lah. We also seeing younger patient, 20 years old, 30
Really?
years old,
Wow.
40 years old. No risk factor. That means they don't smoke, they don't drink, but they come with oral cancer. For that kind of patient, so far we said probably it's genetic. That means your immune system is already low to begin with, and then at a certain point of time, the cancer cell just take over.
I see.
Then you end up with the cancer. From my experience, personal experience, those people who come with this kind of cancer without no risk factor and all that, the cancer is a bit more aggressive.
I see.
A bit more aggressive. So we have to catch early. We have to treat early so that the prognosis, that means the curability percentage to cure the cancer, oral cancer, is higher.
So when we talk about oral cancer kan oral cancer itself is macam general, There can be different types of not specific, ya betul.
Name of the 90% of cancer in the oral cavity is called oral squamous cell carcinoma.
Okay, what is that?
Oral cell, it's because when you say oral squamous cell, it's a type of cell that is in the oral cavity,
Mm-mm.
along the gut and all
I
that.
see. Okay.
Yeah. You also can have a salivary gland tumor. You also can have soft tissue tumor, sarcomas and all that. But that is compared to the oral squamous cell carcinoma, it's about 90%.
Mm.
The rest, the salivary gland tumors and the sarcomas and the lymphomas are much lesser.
Lymphomas.
Lymphoma is a blood related
Mm.
cancer which can happen also in the oral cavity.
I have a story, Doctor. Saya ada story. When I was Form 6, Form 5, 17 years old, I was in Tawau.
Ah,
And sebelum SPM, there's something in my cheek, you know. So like this big lah. And then kalau saya kasih goyang-goyang pakai lidah kan, I push it with my lidah. Dia macam boleh goyang-goyang. I thought macam apaan ya?
Yeah.
And then I went to hospital, pergi cek, rupanya ada. They said it's lymphoma. So inside here. And then before SPM, I got it extracted lah, pergi bedah apa semua. And dia orang cakap, the specialist cakap, there is a risk yang kau boleh hilang kau punya deriah. Deriah apa ya? Deriah. But everything went smoothly lah. And they extracted. And dia orang cakap, yep, it's good that you came early untuk cek dan untuk buang.
Correct.
So, how do you know if you come early ataupun lambat?
The size. Like oral cancer, the squamous cell. When I say oral cancer, mostly it's like oral squamous cell carcinoma lah. Because you have they call it a non-healing ulcer, which is not painful initially, and doesn't heal in about 2 weeks time. Okay, any normal ulcer, you must have pain, and it must heal.
Okay.
If it doesn't heal, and initially there's no pain, then you have to suspect something. So that's when you have to go and see the dentist. See, the dentist, why I say dentist is because when you do dentistry, when you study for dentistry, we don't study only the teeth. Actually, we study from head to the thorax.
Oh, okay.
And emphasize on the oral cavity. So our training itself, we are trained to see changes in the oral cavity comparatively to the general doctors. They are more like scope and other part, but for as a dentist, we are trained to see oral cavity day in and day out. When you see, when you want to treat the teeth, before you want to touch the teeth, you have to examine. That's how you were trained. So if let's say there's an ulcer in the tongue, chances are the dentist can pick it up faster. And he knows what to do, where to refer and all that. Because I had patient who come to me at the later stage, still operable, lucky. But they said, I said, when you noticed this about 3 months back. Then I said, why never come earlier? No, I went to this particular doctor.
Not the dentist.
No. Then they gave usually they think it's infection, so they give antibiotics, never heal. Then they don't go to the same doctor, they will go to another
different doctor.
That doctor or another antibiotic.
Yes, similar.
So it's like time is the essence there, So people, when they go doctor hopping, shopping or whatever, so that delays the time. So one fine day, for some reason, somebody will say, go and see this Dr. Gigi. That fella can pick it up most of the time, So that delays so the more you delay, the tumor will grow, and then the treatment become much more complex.
I see.
So the smaller it is, the treatment is much easier, faster, and to cure it, the percentage is higher. Comparatively, when it's already big and already spread to other places. Usually, oral cancer, first place that it will spread is to the neck.
Okay, yeah.
Something called lymph node.
Lymph node, yeah.
So the surgery, when I said neck dissection just now, we're supposed to do neck dissection to remove the lymph node. Even the term when you say, when patient come, we say, kena buat pembedahan leher. For them, it's like, potong leher.
That's what I was thinking.
Yes, correct. So we have to, I'll explain to them like, dekat leher ada saluran darah. di tepi-tepi saluran darah ada biji-biji. So kenapa nak keluarkan biji ialah sebab kanser sel tu boleh merebak melalui biji-biji ini. So bila saya cakap pembedahan leher, maknanya pembedahan untuk keluarkan biji-biji pada saluran darah
Iya.
di sana. Bukan mau
Bukan
bedah.
potong buka-buka terus.
Yeah, correct.
Iya.
All that I learned along the way how to explain. Hopefully they understand.
I think for sure they would understand.
Yeah.
Dan for my case, last time it happened, they told me it happened because saya tergigit saya punya, pipi di dalam.
Yeah.
So over time it developed into a tumor
Tumor.
inside.
Mhm.
But that's my story lah.
Yeah. Right.
And luckily now tiada apa-apa because I think that was the reason.
2 years back, 33 years old lady from Tawau, married with 4 kids. She just gave birth to a twins.
Oh wow.
She had a tumor at the joint, outside the joint,
Okay.
small one. Then went and saw a doctor. For some reason, treatment was delayed and this and that. Tumor became so huge, very huge.
Can I ask how huge, how big is it?
Initial was about 10,
Like 1
10,
inch?
10 cent
Oh, 10
coin,
cents. Okay.
10 cent coin. When she came to us, it's already like half of the face is
Really?
already swollen. It's like coming out like that. She cannot open the mouth and all those things. And then certain specialists said that there's no way, game over for you.
Oh no.
Then they came to us. She came to us, then we also told her we'll take only 50-50 chance lah. If you don't do, you probably another 6 months. If you do, maybe we can give you a longer period of time, but I can't promise you how long. I still remember her. She hold my hand. She started crying and said that please do, tolonglah doktor buat apa saja. Saya akan ikut apa yang doktor cakap. Then she said, saya nak tengok anak-anak saya membesar. Because the twins were now just born, newborn lah. And then because it's at the region where we need to collaborate with many other surgeons.
Yes.
The neurosurgeons, the oncologists, the orthopedics, and all those people. So we had a discussion, and then we come to a conclusion. Okay, we'll go ahead lah. Everybody know chances are 50-50. So when we remove a tumor, for us we have to remove it in totality. If
Yes.
even leave a bit of the lesion there, chances are it
will grow.
bigger. Yeah, correct. And thank God, when we did the surgery, when we sent to the pathology, they reported the tumor. We managed to take out the tumor in totality lah. So far, it's already close to about 2 years. She's
healthy.
Yeah, she's healthy, still tumor free.
Wow.
Until now, we still keep in touch. Whenever I go to Tower, she makes sure that she come and
Wow, that's lovely.
the whole family,
Yeah.
the whole family, not only her, the whole family will come and see us, and then
That's lovely, man.
yeah, correct, yeah. So yeah, that's what tumor work. Yeah.
Yeah, I mean that's a touching story too because you change lives. Your work, you change lives.
The patient and also the family members. It's like most of my patients, especially the younger ones, they'll say like they reborn again. The perspective of their life changes.
Yeah.
Once they have before cancer, after cancer. Doesn't matter whether the young one or the old one. The way they look at life changes. That's what I observe lah. The way they look at life, it changes.
How about you as the doctor, as the person who took care of that?
Okay. For me, it makes me very humble. It teaches a lot of things. Like anything can happen to anyone. Life is a bit short. You have to empathize on people. For me, I always tell my surgeons, my officers. Being a doctor is just a profession, you know. Your character comes first, then only your profession. Especially when you deal with cancer patients, you know. When you deal with them, when you say cancer, as I said, it's a death sentence for them,
Yeah.
and they will be clueless what's going to happen to them. I can tell you another story.
Sure.
The patient, another CA patient, he's a doctor.
Okay.
Patient is a doctor,
Like medical doctor.
medical doctor. Son is another doctor. Some or other, the patient had cancer, oral cancer. And then they were asking, and patient is not from here. Patient is from Semenanjung.
Oh, okay.
Yeah. They were asking who can do the surgery and all that. And then a friend of mine told, hey, why don't you go and talk to Dr. Sara? You know. Then then they called, we spoke and all that. I gave my opinion. Then they said, okay, we do it here. So we did the surgery. Patient is about 78 years old and all that.
Wow.
So we did the surgery about 2 or 3 months back, and now he's going for radiotherapy. You won't believe, well, the first time when after surgery, before he goes for radiotherapy, he came to my clinic for review. He just like prostrate.
Really? Wow.
I couldn't how do I say
Stefan.
that? Oh, that was I would just hold that. He's 78 years old and he's a doctor. Then I said, Uncle, what are you doing? You don't do all this.
So he came into your office and then
Yeah, I wanted to
really do
review
that.
him. Yeah,
Yeah.
I wanted to review him. So what I'm trying to say is it changes people's thinking or how
Value how they value their life. I think.
their life and life of others as
Mm.
well, you know. Yeah, it's a very humbling situation. Every time when I see a patient who come and then go back okay. I also have seen patient, we do the surgery, in matter of months it comes back, matter of years it comes back. So when it comes back, you still have to talk to them, and then this is more to the family members as well, how to deal with it, how much treatment we can give, what to anticipate, you know. For me, whenever a patient comes, I always tell myself, not only me, few of my friends also, when I speak to them, my doctor friends, that's how they see the patient. For me, if a patient comes, especially CA and all that, I always see them, okay, this patient is my mom, or my dad, or my brother, or my sister. How will I manage them? You know? So the same way I will manage my patient so that I don't take things for granted. We try to expedite. We know because the urgency, you know. So we try to expedite the other like the imaging. We don't wait for the appointment. We go and see the radiologist, ask for a earlier, because this is life threatening.
Yeah, that is true.
Yeah, so you have to do it as soon as possible. If you don't go and see them, they might not see the urgency. You know, if you send somebody go and get an appointment, for them at the counter, they won't know how urgently they need. So we have to go there and speak to the radiologist. Say, hey, this patient is like this, like this. I will do that for my mom and my dad. So I do the same thing for that's how I see it. Yeah.
Because everything starts from yourself. You want to do it for them, right? So if you don't do it, then different outcome would happen.
Yes, correct.
Yeah. So I think thank you for that. Thank you for that. And also, can you tell me like facts? You know, like what are some things that people about cancer that people don't know?
First thing, not all cancer is a death sentence.
Okay, that's one.
So there are a lot of cancers that we can treat, especially like this oral cancer. If they come early, as I said, the chances for cure is very high percentage, about 80, and all that
Mhm.
they come early. What else? I can talk only about oral cancer because that's what
For sure.
I deal with, Second thing is that people don't know that some like when they come to me, why don't come early? Because no pain.
Mm. Yeah, yeah,
No
no
pain.
pain.
So they come to us only when there is pain. So I always tell them this cancer ulcer usually doesn't start with pain.
Mhm,
It
mhm,
just start with some ulceration and all that. So that's another thing that I think they should be aware of.
mhm, mhm,
And then they also should do periodic oral cavity checking by themselves when they brush the teeth and all
mhm,
that. See whether there's any abnormal color changes, ulcer, swelling,
mhm,
which
mhm.
is not there before. The other thing is that the risk factors. You know, I see every tamu anywhere. It's openly
Yeah.
sold your sigu, your
Iya,
sunti
iya,
and all that.
betul.
I go to don't need to go far. I go to Dongong. Dongongon
Dongannya
ada few
confirm ada.
ada kan. So that's if they can stop it, don't take it, maybe we can reduce the risk factors lah.
Hmm,
Yeah. Because these are the confirmed risk factors that can cause cancer.
yeah,
So if they can reduce all those things and all that, probably yeah.
okay.
Yeah.
I
And
mean,
then
sorry?
who to see when they have
Ah.
yeah.
Oh, yeah, yeah, yeah,
Yeah,
that's true.
so that we don't delay
Mm,
in the management, because by the time we diagnosed and by the time we do surgery, we have protocol about 3 weeks to 4 weeks.
yeah.
We have to do the surgery. But if they keep delaying by seeing different doctors and all that, by the time they come to us, it's big. As I said, the surgery will become much more complex,
Mm,
longer hour surgeries, and we can do all that, but the prognosis, the outcome might not be as good as if you
yeah,
catch it
that's true.
earlier.
And
Mm.
also, I think it's generally known. Like if somebody's smoking,
Mm.
they buy this pack of cigarettes
Yeah,
and they see the photos.
yeah,
And usually, what we see is uh, the ones, the cases that like macam ada hole
yeah.
over sini. So that's what is that, doctor? What cancer is that? Is that like
Oh,
neck cancer macam tu?
that could have been a throat cancer.
Throat cancer.
As I said, smoking is risk for everything,
Yeah.
from medical, cardiac, heart issue, or any issue,
Mm-hmm.
including cancer. It's a risk factor.
Yeah. I mean,
There's
smoking.
no two-way. You cannot dispute it.
Yeah.
You cannot dispute it. But I see still people smoking, and I'm not sure why, but they,
And
yeah, sometimes I see the younger ones when they smoke. I'm really worried because I see the consequences, bro.
yeah, that is
Day
true.
in and day out, I see the consequences of the. They don't see that I'm seeing it,
Yeah, yeah,
and
betul.
then I know what will happen to them.
So awareness problem.
Yeah, correct. Yeah,
How about vaping? Is there any cases
same,
from vaping?
same. It's the same, same.
Same, huh?
It's the risk factor is still the same.
Because I'm not vaping. I'm not a
Mm,
vapor, but I also saw like online effects from vaping.
yeah.
You could get cancer from that as well.
That's true. There are some papers and all that,
Mm,
because I think the content of the vape
mm,
itself, I think the liquid that they use and all that, I think still has carcinogenic punya component.
mm.
Often I cannot tell you what is it and all that, but there are a lot of papers came out. E-cigarette,
Yeah, yeah.
yeah, it's a lot of papers, journal, what do you call that? Research has been done, and the risk factor is about the same.
Same with smoking cigarettes.
Cigarette smoking, vaping, comparatively to people who don't do it.
Yeah,
You do this risk, you're already in a
confirm
different,
ada
yes,
risk.
risk already, yes, correct.
Mm,
But it's just that whether you'll get it, or if you are lucky, you won't get it lah.
mm-hmm.
I just had one patient yesterday. He came and saw me. That uncle was 60 over years old, heavy smoker, heavy drinker. They consume a lot of alcohol. He had a tongue cancer.
Oh,
Operated in one place, and then after less than 6 months, came back again.
for
Then the same
oh,
cancer
same.
at the same area. Then he came and saw us, and then after that we did the surgery. He was okay for about a year plus, and then he developed
Oh no.
lung cancer, and then we detected it, and then he went for immunotherapy, they call it, and all that. Now it already touched wood, close to about 2 to 3 years now. He's cancer free.
Because he quit.
Yeah. Then I asked him, hey, you still smoking? He said, no smoking. Most of the patient that I see, they who are smokers, after the surgery, they completely stop.
Yeah.
You don't have to counsel them. I don't have to tell them. That's what I said. It's a life changing
Yes.
surgery, for patient and also for the family members. Yeah, so a lot of experience lah. Because as I said, I've been dealing with this patient and family members for the past 10 years.
Although kalau kata Sanderson kadang-kadang menyigup ataupun suntil itu adalah culture, but
Culture,
culture, it's hard to change culture because it's theirs, But what's important is we tell them that there are risks,
Yes,
to get
correct,
cancer.
correct.
Yeah.
So the thing is that some people who came to us they are like the chronic sigup and the suntil, right? After surgery, stop straight.
Because itu
They already know the consequence.
Yeah, that's the problem with our people,
Correct.
with everybody actually.
Correct.
Diorang tidak akan take things seriously unless it happens to them.
Correct.
So
why you want to wait until to that stage, kan? Because I can see how surgery is not a simple surgery.
Yeah.
Kan? 8 hours, 10 hours surgery, might need to go to ICU. Somebody have to take care of you. Be in the ward for about 5 to 7 days. Why you have to, put yourself
Exactly.
and also your loved ones into all those trauma,
Yes.
both mentally and also physically.
True.
Why?
So take note lah, everyone.
Yeah, that's right. Not threatening or what, but this is I feel from my little experience and the reality that I see all these years lah, yeah.
For sure.
Yeah.
And it's important lah for everybody.
Yes, definitely.
Yeah. And I think you mentioned juga dokter pasal what was that, 𝙀𝙃𝙄𝙎𝙊𝘿𝘀,
Alternative.
the jaw surgery.
Yes. Jaw surgery you can do for many purposes lah.
Oh.
Jaw surgery usually we'll do alternative means ortho means bone lah, tulang.
Oh yeah.
Netic means jaw.
Okay,
Right?
orthonetic lah.
So that means any bone related to the jaw is called alternative.
Okay.
So if you do anything to the jaw bone, it's called alternative surgery.
Okay.
Right? So there are many. Usually there's functional purposes. There's aesthetic purposes also. Right? Functional means how do I say it? Your upper jaw must be slightly in front of your lower jaw. That's a normal biting position, they call it. If your upper jaw is too much in front, it is not good. If your lower jaw too much in front, so not good, or too much at the back. So it has to be in a correct position. If there's a discrepancy in this jaw relationship, then most likely patient might need to go for either jaw surgery or depending on the severity, they can do braces.
Yeah.
That means braces is only to align the teeth, right? So if there's very mild teeth problem and all that, then you can correct it only by doing braces and all that. But if I have jaw problem, then however teeth correction you do, it is not going to solve the problem. So that's when you need alternative surgery. If you ask me, one of the most important functional issues that will need alternative surgery is obstructive sleep apnea.
Right. So what does that mean?
Patient who have who snores a lot, who at night when they sleep, suddenly they will wake up.
Because
cannot
sesak
breathe,
nafas.
sesak nafas. And then they sleep back. Once they sleep back, then they wake up again. Reason being, one of the common reason is the jaw, lower jaw, it's
Bawah, dalam.
ke belakang, right? When your jaw is ke belakang, your tissue, your tongue and all that will also fall backward. When you're awake, your brain is controlling your muscles and all that.
Yes.
So they got no problem. When you're sleeping, your muscles are all relaxed. So the chances are the tongue will fall backward.
Yeah.
Your jaw is already back, so your tongue will fall backward. Depending on how far it falls backward, it will determine the severity of your sleep apnea. You know, some people will fall slightly, so they'll snore and all that. Some people will totally will block the airway. That's when they'll start waking up.
Yeah.
Cannot because gasping for air.
Yes.
You know, this one the issue will start at night because they got not enough sleep, and then they wake up in the morning very stressful, tired because they didn't have enough sleep.
That is true.
Right? So what happens is they cannot perform well in the work. They'll be very groggy, stressful, and all that. That can cause to other heart problem, hypertension, diabetes, and this and that. You know. So when we do alternative surgery, we can improve their.
A lot of things, huh?
Oh yes.
A lot of
But
things.
alternative surgery, this is the obstructive sleep apnea (OSA).
Oh.
It's another field where we need multidisciplinary team. You call it, yeah. We need a respiratory physician there.
Oh,
We
okay.
need a ENT surgeons there. We need surgeons there. We need so many other people, psychologists and all that. So we have to see the patient in a holistic manner.
Sure.
Yeah. Even for oral cancer, I alone cannot manage. We need the oncologists there. We might need the ENT surgeons there. We might need the plastic surgeons there. It's a multidisciplinary approach treatment rather than single surgeon.
Yeah, so maksudnya everybody has to play
Come
their part.
together.
Yeah.
Yes, have to come together, and then we have to discuss about the patient, and then we plan the management. Then we execute the management. That will bring the best outcome for the it's all because for the patient. It's all so we can do multidisciplinary. The outcome for the patient is much more superior comparatively. We just manage the treatment alone.
How about aesthetics? Is there any? Do you do aesthetics as well, Doctor?
When you do facial region,
Yeah.
the beauty of facial
Yeah.
doing surgery in the facial region is aesthetic invariably is already included in it.
Okay.
We don't give any scar on any patient. Other surgeries, if you do something in the abdomen and all that, you wear a shirt, you'll have scar, and whatever you remove for inside the body you can't see. But here, if you any laceration and all that, you
can see.
so when you do alternative surgery, everything is inside the mouth, right? So you don't. So it's already part of the aesthetic. We can also do the surgery cut outside and all that, but we don't do it. Reason being because we take into the consideration of the aesthetic portion.
Yeah.
People say, oh, if you aesthetic mean it's okay, just aesthetic. But it's not just aesthetic. It's a concern. If aesthetically it is not right, psychologically patient will be affected a lot.
Yeah, that is true.
They will have a social trauma, social stigma. They'll get bullied. They don't want to go out, introvert.
Yeah.
You know, a lot of us effect just because of that.
Just because of the scars.
Yes, the scars. Scars, small things. If you do bigger kind of surgery, there are bigger other issues and all that. There's another component called craniofacial surgery. Craniofacial surgery.
That's related
for
to
kids patient, younger
okay.
babies and patient 2 years old, 3 years old, where the scalp cannot expand. When the scalp cannot expand, the brain cannot expand.
Yeah.
When the brain cannot expand, they will have pressure in the brain. The pressure to the eye will increase. They can go blind. They cannot breathe and all that. These are the functional issues. The other issues is they don't look normal
Yeah.
like you and me, you know. So what happens is, as I said, at the young age, it's okay. But when they grow older, they'll get bullied. They don't want to go to school. Trauma, social trauma, depression, and this and that. So, this component it's there. It has to be addressed. Like aesthetic also has to be addressed as one of the major component when you manage this kind of patients.
That's true. Can you share an experience of why did you decide to be a doctor or even a surgeon?
Oh, to tell you the truth, until Form 5, it's very personal story. Until Form 5, I don't have any ambition at all.
Oh, really?
I don't even know whether I'll pass my SPM or not. Okay, and then thank God I passed my SPM. And then the only option I have is to go to Form 6.
Okay.
All right. Either Form 6, I have to go to work. So easy way is to study lah.
Yes.
So go to Form 6. So when I go to Form 6, then only I heard my friend all started talking about, oh, after this one I'll go to university. Then in university I'll do medicine and become a doctor or do dentistry or whatever. Then only I knew, oh, okay. After this
Ada chance.
ada chance boleh. Otherwise I was thinking after Form 6 just go
Kerja terus.
kerja or just go to university and do a degree. And that's why my mom said, after university, after Form 6 you should go to, the aim is to go to university. That's
Yeah.
the aim. Doesn't matter what course you are doing, So I was in that line until I went to Form 6, when my friends all says, oh, I must do. Many of them, they memang now they are doctors, some in private, some in university, doing so that's how but this oral surgery, once I finished my dentistry, then I was working and all that. When I was doing my dentistry, I became very much interested in medical.
Oh, okay.
So when I remember, I said when you do specialization in dentistry, there's many of it are under dentistry except this oral and maxillofacial surgery. This is it's a bridging between medical and dental. So I told myself, if I want to do a specialization, I will do oral and maxillofacial surgery.
So you already have that, like that vision.
Yes. When I start working, I said, if I'm going to stay in the government, this is what specialization that I'm going to do. But venturing into cancer surgeries and all that, it's like I didn't. Once I finished my masters, I just told myself, okay, enough is enough. Just do some little bit of dental surgery, put a bit of implant, just do a bit of accident trauma and all that, and then settle life. But I think the fate had different calling for me. It just took me to somewhere else. This where I am today, I never thought of I'll be doing this kind of surgery before. Never in my life. Yeah.
So it just
It just
happened
happened.
during the
Yeah, I came.
yeah,
People,
okay.
I told you, people said, "Oh, you were thrown to Sabah," and then came here. Then I had a good mentor. He taught me how to do the surgery and all that. Then when he left, then I continued on, and then I had a few good supporting surgeon in my fraternity, and also support from the medical fraternity, the oncologist, the ENT surgeon, the plastic, the Dewa, and ENT, Mr. Ahmad, and so many other my hepatobiliary friend, Mr. Tanish. So many. The support is really good, So when the support is good, you can really give a good outcome for the patient. These are the people who actually patient based.
Right.
Patient based. They are not people who self glorify themselves. Oh, I've done this, I've done that.
They do it for
Patient.
the
They are the main focus is as long as patient can get well by doing certain things, they will go all out to
Oh, that's
get
amazing.
get it done. I see, not surprisingly, for me, Queen is blessed because you see many of them like this. Many of them are
That's good news for us.
yeah. Many of them are patient orientated.
Mm.
Many of them. Yeah.
So that's actually gives a really, really big difference, you know.
Yes,
Yeah.
correct. Yeah.
And also that it comes to this one question where um importance of teamwork.
Yeah, like managing this kind of patient, right? Be it a craniofacial. When I do craniofacial surgery, I need the neurosurgeon to be there with us, the ENT surgeon, the peds surgical, a lot of people, you know. When I do cancer surgery, sometimes we need the ENT surgeon, the plastic surgeon, the oncologist, and all those people. Even the general surgeons to put tube to the stomach for them to feed and all those things. So, I always tell my colleagues, in Peninsula, they're finding it difficult to even digest that we can do whatever we are doing here.
Oh, really? Yeah.
Oh yes.
Oh, wow.
Reason being they cannot.
Sorry, is that yours?
Oh yes.
Okay.
Can I?
No problem, please.
Oh my wife. So they even finding it difficult to believe we can do so many things. So I tell them in Sabah, for some reason, all of us can come together and work. One. And the most important part for me, from my experience, is the teamwork. If there's a team and the team, you work as a surgeons and a physician, but you work in a team. It's different than you work as friends.
How so?
That means, yeah, you have hepatobilitis. I mean, what do you call that? Ahmad is there. What do you call that? The neurosurgeons, my friend Ananda or Prabhu is there. Uh, you know, who else? So we all are friends.
Yeah.
So when you work, your team comprises of friends. There's no, from personal experience, there's no place for ego. But the team comprises of I'm this surgeon, you are that surgeon. When you come together as a surgeon, the dynamic is different.
Yeah.
So when you work as a friend, the dynamic is totally different.
That's true.
So when you become a friend, you are friends. You can be friends only people with like-minded, to a certain extent, correct?
Yeah.
So when you have like-minded, for me, when you have my friends are like-minded, our aim is to give the best for the patient, right? So everybody works toward it. So one example I can give you is, like I said, the PEC tube, right? It improves patient when they go for radiotherapy because orally they cannot eat and all that. So nutrition has to be maintained. When they cannot take orally, sometimes most of the time we put tube to the nose, but that is a bit troublesome for the patient. So what we do, we put tube to the stomach straight, and then patient start feeding and all that. Usual process is you call the department, get an appointment, then patient have to go there, see the particular doctor, and then he'll decide, okay, can do, give another appointment, and then patient go to and then get it done. But like, because my friend Tanish, just a phone call away. Hey bro, I got this patient. I'm operating in 2 weeks time. Can you put the PEC tube or not?
That's awesome.
His first question will be, when you want. You want today? Or you want tomorrow? You have the tube or not? Or you want next week? That's the difference between you work with a surgeon and you work with a friend.
Yeah.
It
That's
makes a
right.
lot of difference.
And that's awesome, man, to hear that.
Yeah. So
Yeah.
as I said, in Queen or in Sabah for the matter, we have a lot of doctors like this. So it's so much easy. I just have to call my radiology friend, Dr. Sumitra or Hafiza. I got this patient. I need an MRI. CA. 2 weeks,
Done.
maximum 3 weeks, I will get the
Mm.
MRI done. Otherwise, MRI months, 3 months, 4 months. Yeah.
And also, this is good for the patient also.
That's like all of us, as I said, when
Yeah.
you are like-minded,
Yeah.
our like-minded means our aim is to make sure that
Yeah.
the patient goes back, the patient gets the best treatment
Yeah.
or the best outcome with whatever limitation that we have lah.
Mhm.
So the way we manage patient is, even if when I go overseas, I see people or listen to webinars and all that. The outcomes are a bit, so it's equivalent or much better than them. Reason because we can
Because
work
of I think
the teamwork.
the chemistry also in the team.
Yes, correct.
That's great.
In terms of equipment also, we are still okay and all that, But when the team is good, it's totally a different thing altogether.
I
The
see.
patient management, I think, tip top lah. Yeah.
Perfect.
Yeah.
You're a surgeon for how long already?
10 years.
10 years. So your first year versus now, what do you think is the biggest difference that you feel then and now?
Most of the time we are in the hospital and all that. So you learn from patients, like the two-way, you know. So you actually, it makes you humble. It teaches you how to empathize with patient. We tend to, because we see sick people day in and day out, many of us tend to forget that we're actually seeing a real person
That
with
is true. That's
emotion,
the
life, and
life.
we are not treating a chair or a table,
Not an object, right?
not an object. Yeah, we tend to forget that. Reason being, I don't blame them also, because you see them every day. It's just another thing.
Yeah.
So yeah, for
About
me,
the
I have
case.
to intermittently have to always remind myself that I'm actually seeing a patient or a person with life. I'm also dealing with his emotion. I'm dealing with his loved one's emotions,
I think for me, kalau saya in that situation kan, it goes back to myself. It goes back to the religion,
Yeah, it's correct.
Yeah, because even religion teaches you to to value life,
Yes,
value
yes,
others. So I think you also have your own beliefs,
yes.
kan? Do you think it plays a role in your
Oh,
life
okay.
as well?
I think it's an absolute good question. For me, I'm a Baha'i.
Mm.
So for me, the faith always ground me, you know. We personally, when we receive, or I receive a lot of we receive a lot of praises and this and that. So if I bring it to my head, then the way I deal with other patients, because the ego will set in.
Yes.
Okay. So religion, as you said, for me it will always ground me. It always tells me that something is much superior. You are given this opportunity. For me, this opportunity is given to me to make a difference in somebody's life. So it is not, and that's a privilege, and it can be taken at any point of time. So I always tell myself, okay, I have to give. For me, it always, like, I have to give the utmost best for the patient. As I said, if it's my mom, what I'll do, I will do the same thing for this particular
For sure.
patient. So I think that thought process, I think, came from from the religion, the Baha'i faith. Yeah. So when you say prayers and all that, you try to reflect and say, you better be humble.
Yes.
Yeah. If you are not humble, all this might be taken away from you.
Yeah.
Yeah.
So in this podcast, I have a tradition where previous guests they will ask the next guest a mystery question.
Ah.
So my previous guest they have one question for you, and then you will get the chance to ask the next guest. So previous guests they asked about fear. How do you overcome fear?
To tell you the truth, every time when I go to do especially cancer surgery, the fear of unknown is always there. The cancer surgeries, I would have performed about 200 plus surgeries.
Mm.
Even if tomorrow I go and do a surgery, the fear. So a fear for me, it's like it's a fear of unknown, right? So when you talk about fear of unknown, it's all in your mind, where they call it. If you talk about scientifically, the fear is for you. It's a good thing because it don't want you to make mistakes, right?
Mhm.
It's a fight or flight
Yes, that is
situation,
true.
flight or flight situation, and it is the basic instinct in your mind,
Yeah.
fear, alright? So that if you read psychology, they'll tell you that brain issues matters. They'll tell you that why you have fear is long time ago when you are in the jungle, when you see something moving, you must decide whether that's a bear or just
Yes.
a. If it's a bear, you better run.
Mhm.
If it's just something else, so you have to make the split second decision,
Mhm.
right? So that's why you have that fear all along. But now when I think about it, it's always about fear of unknown, whether it's a bear or it's just a small insect running,
Mhm.
the fear of unknown. So so that's how I take fear as it is. So I know, okay, this is fear unknown. So how do I overcome it is by reflecting the number of surgeries I have done. That all went on okay, no problem. So that gives me the motivation. Also, I know if there's any issues and all that, I have my backups
Mhm.
who will come and rescue me. Second. Third is, even let's say if I go for surgery, I will explain everything to the patient and family member. Everything. I don't hide anything.
Mm.
So why for me it is very important is when you do that, even if anything happen intraoperatively inside the op or post-operatively and all that, and you own up to it, say, then patient will understand better.
That is true.
Patient will understand. Rather than first you don't tell them the whole thing, not to scare them off, but
Mm.
you have to make them understand everything. And then don't tell them. Second thing is that if anything goes wrong, you don't own up to it. That means you say, "Oh, that person didn't do this thing properly. That machine didn't function properly."
Mm.
Uh, so you blame the whole world, except you
Yes, sir.
admit that yes, I did it. That was my mistake,
Mhm.
and I know how to settle it, or it happens. I believe with that, I think for me, like let's say fear of anything happen, how am I supposed to explain to the patient and all that? But
Mhm.
for me, I feel that I already explained everything to the patient. They understood, and then that's when they give the whole trust for us,
Consent, trust.
consent,
Yeah,
the trust.
trust.
I always don't push them that you must do this particular surgery with me.
Mm.
Never. When they come to me, I just give them my opinion. I said, especially cancer, this is how we'll do it here. If you want, we can do it here. Or you can also go and get second opinion, third opinion. Wherever, whichever doctor that you trust, you do with that particular person. Because this kind of surgery, because life threatening surgery, life or death, you must have the full trust of the
Trust.
patient
That's
and
right.
family members with you.
Mhm.
If they don't trust you and all that, any single thing that happen, then they will blame you
That's true.
for. So for me, that trust is very. So my task will be when I see a patient, it's not talking about how's the surgery, blah blah blah. No, first my aim will be to get the trust
Mm.
of the patient and the family members. Then only we talk. How do you gain the trust? When you empathize, you don't sympathize on patient. When you empathize on patient, you know, then on family members, then you will get the trust. So with this, I can overcome that fear of what if anything happens. Kenapa.
Yes.
And I always tell my patient and family members, uh, patient is the surgery or the treatment is encompassing 3 people: patient, family members, and the surgeon.
Yes.
3 of us has to be in the same platform,
Mhm.
you know, and everybody has to play their role properly. If any one of them not play their role properly,
There would be a
then
problem.
the outcome won't be as how we
Yes.
anticipate or expect, you know.
Yeah.
It's either the family members or the patient or the what do you call that? So the surgeon. I can give you an example. Like we just did one surgery about or a month back in
Mm.
Sandakan. Patient 80 years old,
80.
80 years old, very small tumor, good prognosis.
So when you
Patient,
say prognosis means is the result, is it?
the chances for cure,
Okay, okay.
chances for cure, small one. If you prognosis means that means for 5 years survival rate.
I see.
How much is it? So for this patient, 5 years survival rate is about 80-90%, small one. But even though it's 80 years old and all that, if you don't do anything, 6 months time it's going to grow big
Oh, wow. Okay.
and he's going to suffer and he's going to. But one issue with this patient is he has dementia and he also got psychological problem and he's a chronic smoker.
Oh.
Alright. So pre-operatively we already discussed and all that. The patient component was not optimized. It's not there. It's not that good.
Okay.
Family members is really good. They can take care of the patient and this and that. Then we are okay. Family members okay. Patient to a certain extent. My concern was if I don't do anything for this patient, we don't do anything. In months' time, he's going to suffer because the tumor is going to grow big, and he's going to have a nasty, undignified death.
Mhm.
Right? That was my concern. If we remove it, even if he stay for another 1, 2, 3 years, he'll have a very even if you pass on, he'll have a dignified. The facial
Yeah.
will be the same and all that. So that was my concern. The family members was okay. Patient component was not okay. So post-operatively, because the patient not playing his role, right?
Mhm.
Because he has a withdrawal
Yes.
syndrome, the psychiatric problem become worse. Even the psychiatrist cannot manage him, given medication he don't want to take,
Mm.
and this and that. 2 weeks or 3 weeks post-operatively, he was admitted for some lung infection, and then they said they already got meds to the knee, to the cancer already. But we don't know yet whether it's a
Mhm.
infection or admitted. He doesn't want to take the medication
Oh no.
and this and that. Last Monday, I think he succumbed to death. So what I'm trying to say is, even though
The
the
triangle.
tumor is small, if these 3 component don't play their role well,
Yeah.
the outcome
Yeah.
is not
Yeah.
how we. In terms of surgery, it's a very successful surgery.
Mhm.
Patient family members willing to take care of the patient, but patient he himself probably not capable or what to take care of himself.
Mhm.
Otherwise he could have lived longer.
I think that's a very important sharing
Yeah.
from you, Doctor.
Mm.
Yeah, so thank you so much for sharing,
Yeah,
Doctor.
thank you.
Do you have any macam advice?
A simple thing as not smoking
Mm,
will save their life.
true.
This I'm talking from my
Yes.
experience. No, don't smoke. You'll settle a lot of things, including finance. And
Yeah.
I think a box of cigarette now is what 20 ringgit. Ada 20.
I don't know. I don't know, Doctor.
Uh,
Saya
yeah,
berapa ini? Do you know? Tidak tahu juga.
yeah.
But very
And
expensive.
it's very expensive now.
Super
That much
expensive.
I know. Yeah. So why you pay to poison yourself?
Exactly.
Not worth. If you ask me, it's not worth at all. It is not worth.
True. I
Sometimes you
agree.
just feel like, yeah, why, man? Can
No point kan?
no,
Just for the pleasure saja.
that's the thing. That's the thing. As I said, they don't see it. We
Mm,
see day in, day out.
yes.
I have a 40 years old I see cancer tongue patient,
Mhm.
chronic smoker also, operated now already about 2 years, 3 years plus. Only smoking, nothing else. Now, when he saw that, smoking, no, stop. They said this sometimes like what you say lah, they have to
Experience it first.
but it's not the worth the experience.
Exactly.
This experience is not worth at
Yeah.
maybe we can get the testimony from the patient
Yeah,
and
so I think
survivor, right?
survivor.
Survivor. Probably they can
More impactful, I think.
yes, they can give a better testimony than
Yeah.
like myself,
About oral cancer as well. Does it affect like a different gender differently?
in the world they said male is more than female, but if you take the Sabah context, my personal experience, I see more female than male lah.
Mm.
Again, reason being, I think female yang take more of this Sigu,
Sigu, yeah.
and all that. And then even if I go to Tamu, the one selling is female.
Female, mostly
Kan, I
female.
think if
Yeah.
I'm not, if I
Actually,
think
most of them are female.
female, kan. I think the customer also a female, I think. So
Tingkat.
yeah.
The suntil is the tingkat.
Tingkat. Oh,
Tingkat, yeah.
okay. A new word. Tingkat.
Tingkat.
Tingkat means?
The suntil, the bulat-bulat.
Yeah. Sometimes we don't even know that's actually, we thought that's a growth.
Yeah.
That's the,
Rupanya ada dalam tuh.
yeah.
Yeah. How does alcohol contribute in, giving you cancer?
Alcohol, scientifically, they said usually alcohol is metabolized in the liver, right?
Yes.
So that's why you have liver cirrhosis, blood, all those things. But one of the component of the carcinogen in the alcohol, the enzyme is to metabolize the alcohol is in the liver. But the same enzyme, apparently, is also found in the microorganism in the oral cavity. The bacteria and all in the oral, because oral cavity a lot of bacteria, right?
Yes.
So that in the microorganism there, apparently there is this particular enzyme. So when the alcohol pool at the floor of the mouth and all that, the microorganism will release that enzyme. So the byproduct of the metabolism is a carcinogen.
I see.
So it's like a synergistic effect. When you smoke, there's a risk factor. When you smoke and drink, the risk factor it becomes higher. Yeah, that's what it is.
Yeah, that's something I learned today.
So that's why usually when you go, the basic question, do you smoke? Risk factor. Do you smoke? Do you drink? Why we want to know this? It's because
yes,
you want to see how high is your risk that
mm.
can cause cancer. Yeah.
Okay.
Many of us, we think personal life is different, work life is different. That's why I said for me, your character comes first, then only your profession.
Yes.
Doctor is my profession. It's not me. It's my
Yes.
profession. I'm Saravanan. I'm a person by myself. So I have my own limitation, my own strength, my own weaknesses, and all that. So for me to build the character, I feel one of the most important thing is the religion, right? So I want to ask your next person.
Next guess, yeah.
Like your question lah, how does religion actually affect your profession?
This episode kamu boleh tengok di Step It Up Lounge YouTube channel. Step It Up Lounge, create, share, inspire.
Bye.